OCTA Research Group has recommended the extension of the current quarantine classification here in the NCR plus bubble or region in light of the threat of the Delta COVID variant. We have Professor Guido David joining us via Zoom to discuss this further. Good afternoon, Professor Guido. So for how long would you like to extend this GCQ status in the NCR plus?
Well, Sean, it would depend on the trends that we're seeing in the region. Right now, the trends are very good. Our positivity rate has decreased to 7%. Reproduction number is 0.8, and we're averaging about 667 cases per day. This is close to the pre-surge level of about 500 cases per day in the NCR. But having said that, one of the reasons we support the recommendation of the Department of Health to extend the GCQ is because we still want to be careful about social gatherings. We know that a few weeks ago we had gatherings or parties, social gatherings, which resulted in community transmission and a spike in cases in some barangays. So that's something that we want to avoid. But we do support the expansion of capacities in business establishments, in offices, and even reopening some businesses.
Saying is, of course, to prevent another surge from happening. This is even still without the threat of the Delta COVID variant. Do you think these measures will be enough to prevent another surge? We've been in this for over a year now, and do you think people have kind of developed that muscle memory for health protocols?
Yes, well, it's good if they've developed muscle memory for the health protocols. That would definitely help. These measures would help us prevent spikes in cases because of community transmission in barangays or in places where they have social gatherings. It will not likely prevent an outbreak due to the Delta variant at the moment. And that's why we need to make sure that the Delta variant does not get into community transmission in the country, especially in NCR. Based on the information that we have from the genome sequencing, our current information says that the Delta variant has not yet gotten into community transmission in the country based on what we know so far. So we want to keep it this way. So that's why it's important to have strict international border policies, in terms of quarantining people coming from overseas, especially coming from these high-risk Delta areas. I mean, that includes Indonesia, United Kingdom, and other countries. So this is our main main goal right now, to prevent the Delta variant from coming in the country and going into community transmission.
All right, Guido, good to know that the current measures or current border control measures are effective in keeping the Delta variant at bay. But what about the situation in hospitals here in the Philippines? I'm talking about nationwide. Are the numbers still good at the moment? Is utilization at an all-time high, or is it okay? And which places are in the worst spots at the moment?
Utilization in the NCR is very good right now. Based on our latest report, we have 36% hospital bed occupancy, 45% ICU bed occupancy, and 32% mechanical ventilator occupancy. These are all below 50%. They are considered to be safe levels by the Department of Health. However, utilization is still high in areas in Visayas and Mindanao. Specifically, Davao City has 70% hospital bed utilization and 93% ICU utilization. Iloilo City also has high hospital bed and ICU utilization. Same with Cagayan de Oro and Baguio City and Tacloban. So although the trends have started to decrease in many places in Visayas and Mindanao, for example, Iloilo and Bacolod have already seen a decrease in cases, the healthcare utilization is still high, but we're hoping that because of the decrease, the hospitals will start to have more beds available in the coming weeks.
All right, and of course I have to ask you about vaccination. Based on the current pace of vaccination, Is it even possible that we can inoculate even 30% of the population anytime soon, maybe by the third quarter or fourth quarter of the year?
Well, it's definitely possible, Sean. We're looking at the current pace. It's about 200,000 jabs per day. If we follow this current pace, we'll be at around 40 million total jabs by the end of the year. This is barely, well, it's a little short of getting to population protection for NCR plus 8 plus 10. So we need to accelerate even further. Our target is about 350,000 jabs per day at least. I think the government was saying that it could do 500,000 jabs per day. If it could, then good, very good. But we need at least 350,000 per day, and then we'll get to 60 million jabs or 30 million people before the end of the year, and that would mean a good Christmas for a lot of us, because we'll achieve population protection in these priority areas, and that will also cause the other regions to have less of a risk in terms of surges in COVID. So in effect, it's indirectly providing population protection to the other more remote areas.
Never ever forgetting that we're all in this together. Now, Guido, I just wanted to know if you have any other recommendations to prevent another surge in COVID-19 cases. This goes for authorities as well as for the public. And as we, of course, experience good numbers, we don't want to be complacent. So what do you suggest we do while we wait for the vaccines to come? Yeah.
Right, Sean. Yeah, we shouldn't be complacent. Even those, especially those who have received one dose of the vaccine, this is not yet sufficient. We need 2 doses of the vaccine to receive protection. We need 2 weeks after the second dose, actually, to be protected. And as people are getting vaccinated, we should be mindful of the others who have not been vaccinated. And that's why vaccinated people still need to wear face masks to protect those who have not been vaccinated. It's for them. It's not for those who have been vaccinated. But, we're seeing the light at the end of the tunnel. We've had 2 million people receive their second dose. This is about 2% of the population. It's still low, but, we're slowly getting there. By next month, we should have a significant number of fully vaccinated people. We're going to have to be talking about the next normal soon, and how we transition from the end of the pandemic to population protection and the next normal. So the light is at the end of the tunnel. I know people have been getting fatigued because of the COVID, but we are optimistic that this will end soon. We're seeing this in US and in other countries that have received a lot of vaccines. So we're really just waiting for the vaccines, and then we can have a Merry Christmas. And you could probably have your normal Christmas party there in in Signal.
We'll make sure to send out an invite for you if and when that time comes. Thank you as usual for the optimism and your time. Professor Guido David of the OCTA Research Group.